thanks for joining me. I'll be presenting my capstone research proposal today. It is on managing behaviors in adults with developmental disabilities, which we all know about. Behaviors in adults with developmental disabilities are common. They can range from verbal aggression to self-injurious behavior to physical aggressions. Studies estimate that 8% of developmentally disabled clients present challenging behaviors. Severe challenging behavior can be defined as of such intensity, frequency, or duration as to threaten the quality of life or physical safety of the individual or others. There are many ways to manage behaviors. Positive behavior support, medications, they're considered a last resort. However, most developmentally disabled clients are considered dually diagnosed. This means they also have a psychiatric diagnosis. So they're going to be on a psychotropic med, and psychotropic meds, as we know, change psychological functions and behaviors. There are behavioral methods focusing on changing aspects of the client's environment to bring about changes in their behaviors. That is the best idea. Literature review. It's really hard to find current studies on our population. But what I did find was, the one drug one I found was a study on using melatonin for daytime behaviors in individuals with chronic insomnia. It decreased their daytime behaviors, most likely due to improved sleep. Another one is motivational interviewing. It is defined as a collaborative, person-centered form of guiding to elicit and strengthen intrinsic motivation for change. It's cognitive-based and requires at least some abstract reasoning ability. The study sought to identify how professionals could adapt each of the motivational interviewing techniques for use with people with mild intellectual disability and challenging behaviors. 5 motivational interviewing techniques were used. The study overall found that it appeared to be a promising approach for increasing intrinsic motivation for treatment adherence of people with disabilities and challenging behavior. Another one is sensory integration therapy. It explains why the behavior happens and finds ways of intervening successfully. There is a need to develop training programs that focus on sensory integration and applied behavioral analysis to facilitate multidisciplinary working. Strong association between challenging behavior and the triad of impairments characteristic of autism spectrum disorders. While a majority of participants come across most behaviors and considered most of the identified behaviors as challenging, less than a quarter of participants could identify the causative role. There is a need to develop more training programs that focus on sensory integration and applied behavioral analysis to facilitate working and improve professional understanding, and I've said that twice now. Another study investigated the extent that gender, age, and the level of adaptive behavior were associated with challenging behaviors among adults. There is strong evidence between challenging behavior measured using the ABC checklist, which is aberrant behavior checklist. Relationships between staff and clients are important for quality of care, especially when dealing with challenging behaviors. In a study analyzing the influence of interactive behavior of staff toward clients, staff completed 3 questionnaires. The findings of that study support the necessity for training staff to reduce dominant attitudes towards clients. My PICO question is, would a more intensive and individualized staff training be more effective than increasing or adding psychotropic meds in adults with developmental disabilities? What behavior modifications are best for clients and staff? The desired outcome, staff are able to manage behaviors more effectively to reduce the need for psychotropic meds. My theoretical framework is the theory of interpersonal relations by Peplau. The orientation phase identifies the problem. Our problem is behaviors. The identification phase is the selection of an appropriate assistance, behavior management technique that we choose. Exploitation phase, the professional assistance for problem solving, which is the use of behavior training to resolve the problem at hand. And the resolution phase, the client's needs have been met. The client is able to become calm and no longer having a behavior. Our design will be a convergent parallel design, which means I will have two types of data. Qualitative data, which is collected by pre and post questionnaires to evaluate staff perceptions of behaviors. Quantitative data will be psychotropic med use during the study period. It will be set in the day program. The sample will be staff that are working with clients. I will have a control group that will receive no additional training other than current training, and an experimental group who will receive intensive client-specific training on behavior management. I anticipate 8 staff, which would be 4 and 4. There may be some overlapping of staff with different clients. To ensure confidentiality, clients will be assigned a letter and staff will be assigned a number. Only the researcher will know the identity of the participants. I will also monitor behavior reports for the clients during this study period. Observation times will vary to gather data on a continuous basis rather than at certain times of the day. That way we have a little more information. Is this time of the day worse than this time of the day? And the overlapping of staff will be good because we'll know if it's staff causing a behavior or if it's just that client's behavior. Data collection for this study will include observational data during a regular treatment day and utilizing applied behavior analysis. ABA is defined as applied, having a practical purpose to enhance quality of life, behavioral, concern with what people do, and analytic, involved in the seeking of evidence of links between behavior and the environment. I will also use the Carer Uplift Burden Scale to assess staff at baseline and at the conclusion of the study. It has six questions to compute the total score for uplift. Each question in the scale had scores ranging from 1 to 3, where 1 indicates a poor rating, and 2 some of the time, and 3 a better rating. There are 17 questions to compute the total score for burden. Results will be analyzed using two-way analysis of variance, in which differences in outcome will be measured by time and training differences. The chi-square test will be utilized. It measures the relationship between two categorical variables. In conclusion, this study will analyze the effect of client-specific behavior training versus basic behavior training in managing behavior in adults with developmental disabilities. The goal is to reduce the occurrence of behaviors in clients without the use of psychotropic meds. Clients must feel comfortable in their environment and with staff for this to occur.